word of mouth is the best type of advertisement that you could have, that any office could have. So
yeah. You used to do a lot of editing for me when it came to videos and promotional stuff for the Insta. I had a surgical Instagram account.
Oh, like back in the strictly surgery days.
Strictly surgery.
Those were my favorite.
Yeah.
All the blood and guts.
I missed that a little bit. When Nadia and I first started, we took a lot of pictures together, a lot of surgical pictures. I still have them all on my computer. But when we would take those, it required it was almost a full-time job. I mean, I really respect the people that have the longevity and the mainstay in the system to sit there and take those pictures day in and day out, because it requires a lot of editing and a lot of vision and understanding. And sometimes your pictures just didn't turn out. Yeah. And it was frustrating because you'd never get that moment in surgery back. Mm-hmm. But it did provide us a lot of content to learn and work off of. Of course, patients didn't like it either. You know, that was another aspect. There's kind of two media personalities you almost need to have, the surgical side and then the social personal side, right?
Correct.
And you probably, even working restorative and surgery through your time on social media, we'll call it Instagram, have had to sort of censor yourself depending on the people that
depending
are
on my
you.
audience. Yeah. They're like, ew, I don't want to see this. What is that? Somebody's like gum tissue? Like, is that sutures?
Yeah.
Yeah. When
I started the Instagram, I had a lot of friends that were like, oh, Implant Viking, let me look at that. I want to support you, all of that. They were great supportive friends and family. And almost all of them were like, I used to follow, but I just flipped through yours real quick, or I ignore you, or I blocked you, or whatever, because I couldn't tolerate it anymore. I had to
silent your stories.
Yeah, and I think that negatively affected me, because I now have that people come in when I tell them about the podcast. Yeah, they kind of instantly go, "Great, I guess I'll listen, maybe." Yeah, you know, they're not as supportive because they think that we're going to be sitting here talking about, you ever have that bone just crack underneath your hand and that feeling, they don't want to be grossed out. Yeah. And that's the tough part too, is we're trying to sell surgery to a population that needs it. But we are trying to sell it. We're trying to sell something that hurts to take care of a problem that is going to require pain, that does require risk and big financial commitment. We're trying to sell that as something that's sexy and fun. And you can only go so far with that, you know?
But it's the reward. It's what comes at the end of that. They get their smile, they get their respect back, they get their health back. So, I mean.
There's the other side, too. I'm speaking directly of our prior work experience. Mm-hmm. The cameras and the lights don't always tell the whole story, right? Yeah. Even if you're watching this today, you can't tell whether or not I run a really tight operation or a sloppy one. I'd hope that people would assume that it's a tight one. It's a tight, good one. But, we've been a part of some offices that were
pretty chaotic,
really flashy and great marketing wise. I mean, we had, remember Chris, he did video for, I think he did some work on Avengers. Yeah. He did some work with,
was it Avengers or like Walking Dead? I know one of them, there were a couple different camera crews, and one of them worked on The Walking Dead. That was cool.
Some of that, I don't remember exactly what movie it was. Maybe he turned down Avengers. I know he specifically did the video for most of the John Hamm, narrated Mercedes commercials during that time.
Yeah, I remember that.
Those. So he did some really high-end level work. Yeah. And then behind the scenes tended to be somewhat more chaos than you can imagine, and we fought through it and got through as best we could. But sometimes those cameras and that flash don't always tell the whole picture. And so managing that, like, we may know that that's not that important, but is it important to the patient, right? Is that something that's required for success, is having the budget, if you will, to afford the high-end sexy lights? I would argue that through this process, I've found that the world is sort of changing to the point that it's really just, if you can get a real person, and a camera in front of them, and they say, this is awesome and it went fine, that's a whole lot better than how beautiful blue, yellow, and strobing lights you can make your machinery look.